This session is about adherence.
What is adherence?
Adherence is the capacity of the patient or client to be involved from the beginning in the selection, control, and follow-up of ART in a way to keep his viral load undetected and good clinical response.
Why is adherence important during my HIV treatment?
Adherence, or taking your pills regularly and correctly and on time, is critical for the treatment of HIV. It is the most important issue because this virus is only kept suppressed if the drugs are actually in the blood at all times. The only way to keep the drug in the blood at all times is to take it very regularly at an interval that keeps the level up before it drops down to zero or even close. That is the biggest and most difficult issue for some HIV patients, to adhere to taking their medicines regularly. Those that can do it extremely well, and that's about a half to two-thirds of the patients. Those that, for whatever reason, can't regiment their life to taking a pill once a day if necessary, or twice a day if necessary, depending on the regimen, tend to do poorly. Taking the drugs every day in the specific dose and at the specified time is known as adherence. The major obstacles to comply are irregular working hours, illiteracy, lack of regular access to food or clean drinking water, a few doctors and nurses to diagnose, prescribe, and advise on ART, and drug resistance. Our goal is to achieve an undetectable viral load and prevent the development of drug resistance. A person on ART needs to take at least 95% of his or her treatment. Less than 90 to 95% of correct taking of medications equals failure.
So, how does accepting the fact that I have HIV help me with my medical treatment?
Well, just hiding your head in the sand with HIV doesn't work because it just keeps going. It's very important, I think, psychologically, for the HIV-positive patient to realize they have the disease, to accept they have the disease, and not try denial, because denial doesn't work. Accept what you cannot change. You've got the infection, and accept that you have to take your pills to control it, and you'll be fine. Those that can't accept that they have HIV may stop their therapy, and they may do very badly as a consequence.
Well, why does it matter?
Well, only the understanding the complicated interplay between the clinical and social factors that affect adherence to ART can we hope to overcome the real causes of non-adherence. Some multiple factors of adherence: socioeconomic, healthcare system, social, cultural models, personal, psychological, clinical, and ART regimen. Let's get started with some socioeconomic factors. Poverty and inequality, war and political violence, cost of medications, cost of CD4 counts, viral load, cost of missing days from work, and other costs. In poor settings more than anywhere else, is critical for caregivers and healthcare workers to understand how adherence works. Healthcare. Poor healthcare infrastructure, drug stock shortages, financial mechanisms, quality of relationships with healthcare workers, no confidentiality, no qualified personnel. Cultural model of etiology and transmission, on healthcare providers and healers, on cure, on efficiency and toxicity of drugs. Psychological, self-esteem, and mental health conditions. Personal factors, age, sex and gender, education, ethnic group, occupation, household composition, and substance abuse. Convenience means when the drug can be or cannot be taken consistently because it is hard to tolerate, difficult to fit around meals, or because it involves a large number of pills. In these possibilities, the chances of treatment failure are high. This is related to tolerability, which means how well the patient handles or avoids the side effects such as anemia, rash, vomiting, neutropenia of few white blood cells. The Thai Ministry of Public Health's pilot program to provide ARV treatment in northern Thailand enrolled 774 adult HIV/AIDS patients in some provincial hospitals during 9 months. 531 were still on treatment, but 243 had discontinued it. 101 had done so due to adherence events, nausea, vomiting, diarrhea, anemia, headache, and dizziness. 41 had died, at least 50% of them from HIV-related reasons. 42 had treatment failure. 35 had defaulted, not turned up for clinical appointments. 24 other reasons for discontinuing.